We're here at the 25th Conference on Retrovirus and Opportunistic Infections. We're here with the Minister of Health of Lesotho country in South Africa region of Africa. And I'm going to ask you to further introduce yourself to show exactly what your responsibilities are.
Yes, I'm a medical doctor by background and working for the Ministry of Health in Lesotho, and then I'm responsible for research. And my title is research manager. And I come here as a representative of a study team. That we have a team that we conduct a study or survey. It is what we call LIFIA. It is Lesotho Population-Based HIV Impact Assessment Survey. So it is conducted in maybe 14 countries in South Africa.
So not just Lesotho.
Yes, Lesotho is one of those.
Okay.
Because the problem is that those countries are highly impacted by HIV epidemic.
Right.
So this LIFIA, or this FIA surveys are done. And then when it is conducted in Lesotho, it is LIFIA. When it is conducted in Zambia, it is ZAMFIA. In general, it is FIA survey.
So the work that's being done is around the subject of the 90-90-90, which is a hope that we will get to at some point. And I think it's a worthy goal. I would like for you to say what your outcome is.
Outcome is, we can say it is satisfactory, because our achievement for 90-90-90 is that, first target 90s we achieve around 72%. Second 90 we achieve around 90%, and then that 90 we achieve 88%. But for your information, the first 90 is the most important, because this is the entry point to the whole cascade.
Right.
Only when there is a good percentage, then the others are
testing is really important.
Beneficial to yes.
I think I think the reason why we do the 90-90-90 is because that's what you need to get to show reduction.
Yes,
a serious reduction in new infections.
Yes.
So that's why you're saying the first 90, which is testing
very
and
important,
so forth.
Yeah. Yes.
So what are your missions at this point, with having presented the data and so forth?
So what I want to tell you is, as I told you, the results are satisfactory, but we have a long way to do, because since first 90 is low, other 90s are.
So you have to find out how to improve on that outcome.
Yes, how to improve means in this result it shows that the problem is especially younger age group, under 25. They do not know their status. Their proportion of those who knows their status when they are HIV positive is low, so that they are low in taking ART, and then also low in viral load suppression. So the problem is that the problem is in the younger age group, and by gender, males are lower than females. So that if I have to suggest for the way forward, we have to stress the health programs for young age groups and for male.
So there are more women that get tested than men?
Yes.
Yeah, and there are, so there is a challenge there with the young men, especially young men.
Yes.
Okay.
Yes.
So what do you feel it's just that they don't seem to have that sense of concern or fear about AIDS anymore, or do you have any sense of the what's going on in their minds?
I think the most important thing is their knowledge, and then they don't know the seriousness of the disease, because the disease is, as it is terrible. It affects all the areas of a human life, social life, education, business, everything, and family life. But they do not concern about that at their young age. Right. So that if they concern about that, they will come and they will test, and then the awareness will be high, and then other outcomes will be
Right, and the other
higher.
thing too is I think, correct me if I'm wrong, but I think most younger people that are when you're first infected, you don't demonstrate any disease right off the bat. So
This is a very, very good question. And then, when you when you get infection, the symptoms they
years.
don't show. It takes years.
So their friends wouldn't be appearing to be sick.
Yeah.
They are not sick, and they feel like okay, it's not real for them.
Yeah.
Whereas if they saw a friend that was their age, maybe getting sick and dying, it would make a difference. But by the time they get sick, they're whisked off to some place that's treating them, and they're not around. I don't know. I think we probably need to have more people that are given the information about being healthy or looking healthy. Does not mean you are healthy.
Yes, it is a key point in the facts for education for HIV/AIDS. Even this man or woman is healthy and looks nice like a film star. She or he can get HIV infection.
Right.
He is a person with HIV infection. So what I mean is, the external appearance of a person doesn't mean for HIV.
Right.
Anybody can have HIV positive. So that many years, maybe 5-6 years ago, we launched a program that in short what we call KYS, Know Your Status, so that everybody should test. This is the main thing. If they test, they will know the result, and then we can counsel them and treat them.
I think also telling them that if they are positive, that there is treatment that can allow them to live healthy
Yes.
for the rest of their lives,
Yes,
as opposed to
yes.
waiting until they get sick,
Yes.
and then it's hard to get their immune system back.
Yes,
not
when
impossible.
now we are launching our test and treat program. Test and treat mean it is different from the past. In the past, we even though a patient or a person is positive, we do not treat immediately because we check for CD4 count and general condition, everything. Now our policy changed. Once a person is infected, we give treatment,
Right.
and then if they take treatment regularly, the viral load suppression is more than 90%.
Right.
And then, in that case, since your viral load is suppressed, you cannot infect two anymore. And then
Highly unlikely.
Yes,
Yep,
yes,
yep,
and
yep.
then they can enjoy normal life.
Right.
Yes.
Well, we've got it down. Now all we do is implement it.
Yeah.
If we can do that, I don't know.
Yeah.
If anything we've done here today
Yes.
now
Yes.
it can improve that situation,
Yes.
let me know.
Yes, yes. So, in other words, naturally in public health, health education and awareness raising is very important.
It's the key piece.
Otherwise, they will not come. Even though we open our clinic, we prepare with many facilities like condoms and medicine, they will not come.
Exactly.
Yes.
Well, I wish you luck with your programs, and I certainly hope that for the sake of
Yes.
country and worldwide,
Yes,
that
yes,
we really do
yes.
have more uptake on
Yes, yes.
on testing, treatment, and successful treatment.
Yes, yes, thank
it's
you.
all really important.
Yes, yes, and maintain the treatment, and then for those who are negative, to maintain the negative.
Exactly.
Yes.
Exactly.
Okay.
Thank you so very
You are
much.
welcome.
I
My
appreciate
pleasure.
it. Yeah,
Yes,
yeah.
yes. Thank you.